I'm John Peller, President and CEO of AIDS Foundation Chicago, and I'm just really thrilled to be here talking about my 10th anniversary as President and CEO at AFC. Gives me chills a little bit to say that. Oh my God, I can't believe it's been 10 years. I actually started at AFC 19 years ago when I was a wee little one, and started as our Springfield lobbyist. And then became Vice President of Policy, and then in 2014 was named as President and CEO. So there's a couple things that I'm most proud of at AFC in my decade of leadership, and I can't believe I'm saying a decade. But one that I really want to highlight is how much the organization has grown. And of course, growth isn't everything, but it's still really important. And when I started at AFC, we had a $24 million budget, and we're now up to about 41, which is a 60% increase, which is a lot. And we've also grown in the number of staff. We had 128 when I started as CEO, actually 35 when I first started 19 years ago. But we're now up to about 180 staff, which is also an amazing increase. And it's not just about the money, it's not just about the people, it's about what we can do with those people and with that money. And it's about the community partners we've been able to bring on who are new contributors to our efforts to end the HIV epidemic and end homelessness. New people, new energy, new ideas, and new resources that are helping us to end the HIV epidemic and to end homelessness. I think the second thing that I'm really proud of at AFC over my 10 years here is our leadership of the Getting to Zero initiative, which aims to end the HIV epidemic by 2030. And in 2016, that was just, a glimmer in a lot of our eyes and an idea that a lot of us here in Chicago had. And I pulled people together, leaders in the sector, and most importantly, our community partners, people living with HIV who were in the room from day one, because it's so critical to center the voices and experiences of people living with HIV as we try to end the HIV epidemic. And here we are in 2024, we're on the second iteration of the Getting to Zero plan. Just so grateful to the support from our co-leaders at the Chicago Department of Public Health, Dave Kern, and IDPH, Andrea Perez, and of course our funders who have supported the idea, our legislators, Governor Pritzker, Mayor Johnson, all of the leaders across Chicago, including people at probably 50 organizations across the state, hundreds of advocates who believe, like we do, that we can end the HIV epidemic by 2030. A third thing that I'm incredibly proud of at AFC is our housing footprint. And today, AFC is housing about 1,000 people living with HIV a year. And that's increased by almost 500 people since I started. And we are also housing over 1,000 people who are formerly homeless and living with chronic illnesses like heart disease, diabetes, cancer, or have been impacted by violence. And so between our two programs, AFC and our subsidiary, the Center for Housing and Health, we're housing over 2,000 people a year. And it's in some ways a well-kept secret that AFC is as much an HIV organization as we are a housing organization. But that impact is, it just astounds me. It astounds me every day that we're providing stable, secure housing to over 2,000 people a year, most of whom were formerly homeless, many of them living literally on the streets and unable to manage their health. And today they're healthier, they're on a path to stability. And for the people living with HIV, they're far more likely to be on treatment and therefore not only thriving themselves, but less likely to transmit HIV to their partners. So what motivates me to keep moving forward in the work is the people around me. I'm just so grateful to people like David Munar, who was my immediate predecessor as CEO, Mark Ishag, who led AFC when I was hired, Jim Pickett, who was my first supervisor at AFC, and then we worked together for many years. Those are the folks who I've learned so much from, and whose torch I really carry today. I'm so inspired by our board members, who, particularly our board presidents, who have mentored me along the way and helped AFC really become the organization that it is today. And of course, my incredible colleagues, the folks on the senior leadership team, who every day push me to be a better leader, our staff, who hold me accountable all the time. And I love that and welcome that, because together we're building better programs. We're doing a better job of helping people living with HIV to thrive. We're doing a better job of preventing HIV, of passing better policies because of this input that we get from our over 50 partner organizations, our community members, our community advisory board members, and of course our clients, the over 8,000 people a year, people living with HIV, people vulnerable to HIV, and our housing clients who we support. So it's really the people around me and the work that they do to inspire me that keeps me moving forward. So a time where I found a lot of joy in a difficult situation was through the COVID pandemic. And, like so many organizations, we had, days to turn everything around, get everybody working from home, get everything set up, and support our clients. Most importantly, making sure our clients were able to get the resources that they needed to survive. And truly, we were talking about helping people to survive. We had just launched the HIV Hub, our partnership with Center on Halsted, and the hub was able to really quickly put together emergency financial assistance support for people, helping people who are suddenly unemployed pay their rent so they weren't homeless, get groceries delivered to their homes when they were afraid to go to the grocery store because many of them are immunocompromised, and we didn't know that folks could wear a mask and have tremendous protection. We worked so hard to support our staff and support our partner organizations who just are really out there on the front line day in and day out doing the work of supporting our clients and helping us to achieve our collective goals of supporting people living with HIV and who are in our housing programs. So I'm hoping my legacy at AFC goes beyond just leaving a stronger organization that has a better foundation, that is better resourced, that has just better systems in place. One of the things that I'm so proud of that we have accomplished at AFC and really are still working on, because there's never an end, is becoming a more racially equitable organization. And so about 3 years ago, we worked with the Morton Group to develop a racial equity action plan. And we've spent the last 3 years putting that into practice. And we, of course, haven't done perfectly. We haven't achieved everything we set out to do because we were way too ambitious, but lessons learned. We'd never had a racial equity action plan before. And today our board is over 65% people of color. Our leadership team is over 50% people of color, and our staff are majority people of color. And of course, we have a lot of work to do to become a more racially equitable organization. But I recognize that as a white cis male, it's my role as a leader to set the tone for that work and to say that it's a priority, and to think through the trade-offs that we have to make between doing this project or working on a racial equity project. And we want to get to a point where it's not either or, it's both, where racial equity is integrated into our DNA as an organization. Because if we can become more racially equitable here at AFC, that paves the road to confronting the racist systems that are driving the HIV epidemic and driving homelessness. The reason that 80% of people in Chicago are homeless, and because 70 to 80% of people living with HIV are Black and Latinx, is not because of something those individuals did. It's because of the racist systems that are driving those poor health outcomes. And we've got to talk about the impact of those racist systems. We've got to talk about the symptoms, and we've got to address those symptoms, but we also have to address the root causes. And that's what we do through our policy and advocacy work. Policy and advocacy has been part of AFC's DNA since the beginning, 40 years ago. And I'm so proud that our policy work continues as strong as it is today. As I think back on my time at AFC and think back to 2014, the landscape of the HIV epidemic has changed so much. And in 2014, PrEP had really just been introduced, and it had been out in the world for maybe 2 years. Today, we have 3 different forms of PrEP that are available. We now know on the HIV treatment side that U equals U, and that when people have an undetectable viral load, they can't transmit HIV to their partners. And that was new information in 2014. We were still trying to figure out how to talk about that. And now it's really become integrated into our work and into our vocabulary. And the degree to which we have incredibly effective HIV treatment is also just astounding. When I started in 2005, the first 1 pill once a day HIV treatment had just been introduced. And now we take that completely for granted. What hasn't changed, unfortunately, which is just so frustrating to all of us in the HIV sector, is the racial disparities that we see. The fact that Black and Latinx people broadly are still the populations most impacted by HIV, that Black and Latinx gay men, Black and Latinx trans women, Black cis women still are the populations most impacted by HIV, is deeply, deeply frustrating to me. And that's the work that we do every day at AFC to level the playing field and put in place programmatic interventions, but also policy interventions and policy change, and advocate for funding that's going to change that narrative. And that's how we're going to end the HIV epidemic and get to zero.